All right, hi everybody. We're going to get started on GI drugs. I was trying to fix the font on this, but not a big deal. So GI drugs, what I want you to do is, if you need a break, stop it and get a break. Remember, you can eat snacks while you're watching this, though, okay? All right, so GI drugs. I'm going to keep it in this way because there's some notes underneath it, and I want to be able to use that part of it. So, all right, so what does the stomach secrete? So it's really important in order to understand the drugs that you're going to give, it's really important to know what is in your stomach, because the drugs are actually helping or inhibiting certain chemicals or enzymes in your stomach to help the specific symptoms. So let's talk about acid-related pathophysiology. All right, so your stomach secretes hydrochloric acid, bicarbonate, pepsinogen, intrinsic factor, mucus, and prostaglandins. So what is hydrochloride? It's an acid that aids in digestion, and then it also serves as a barrier to infection. So that's why a lot of people that take antacids and things like that over time, sometimes it can decrease that acid so much it promotes a haven for infection to get in there. Bicarbonate, it's a base. Think of like sodium bicarb. It's a base that prevents hyperacidity, so it kind of keeps things balanced. So you have the hydrochloric acid and the bicarb. Pepsinogen is an enzyme, and it helps to digest your proteins that you're eating. Intrinsic factor is a protein, and it helps your absorption of B12. So if you ever hear people getting B12 shots every month, B12 deficiency, that has a true B12 deficiency, they're missing that intrinsic factor. It's a blood draw that you can get that will show whether you are missing the intrinsic factor or not. So if you're missing it, you're not able to absorb the B12 by eating your food and even oral B12 supplements, so then you'll need a shot. Mucus, obviously, that protects the lining from the acid, which is your hydrochloric acid and the other enzymes. And then prostaglandins. Remember prostaglandins, we talked about that a little bit before. They help with anti-inflammatory as well as protection. So it gives you an idea overall of what is in the stomach that either can get off kilter or what's supposed to stay evenly functioning in order for you to digest your food and prevent ulcers, etc. You have certain glands in your stomach also. Cardiac, which is kind of strange, but it's true. Pyloric and gastric. So the cells of the gastric gland are the largest number and of primary importance when discussing acid control. So the stomach's divided into 3 functional areas, each with specific glands. So the cardiac zone cells, that's the uppermost area of your stomach. By the cardiac sphincter, it contains cardiac glands. The pyloric zone, the lowermost part of your stomach, contains pyloric glands, and then the bigger part of your stomach is the fundus, and that's your gastric glands. So the gastric glands play the most significant role in acid-related disorders. Cells of the gastric gland. So first we talk about the acid chemicals. What does it contain? So that's your hydrochloric acid, your bicarbonate, pepsinogen, intrinsic factor, mucus, prostaglandins. We have that, the chemicals. Now we have the glands, and now we have the cells. So we have parietal cells. We talked about that last time, your parietal cells. They produce and secrete the hydrochloric acid, and this is the primary site of action for many of the acid controller drugs that are out on the market. Okay. So hydrochloric acid, which was the first one listed in the slide before, a couple slides before. It's secreted by the parietal cells when stimulated by food. Eat a hamburger, eat anything, it's going to go down in your stomach, and you're going to secrete hydrochloric acid to help break down the food. Remember, the stomach has to have a specific pH for maintaining homeostasis, a pH of 1 to 4. So if you can see, if you have an ulcer, your pH is going to be off kilter. Secretion's also stimulated by large fatty meals, if you're drinking a lot of alcohol, and emotional stress. So really the mind and body work together. So if you think, a lot of people, if you can relate, if you have like anxiety issues or just get nervous before an exam, right? Some people get diarrhea or just stomach, get some nausea, not feeling well, because the mind and body are working together to release chemicals, which then in turn cause this hydrochloric acid to hypersecrete at that point. All right, so to go on for cells in the gastric gland, the chief cells, they secrete the pepsinogen. It's called a proenzyme, but they secrete the pepsinogen, which becomes pepsid. Pepsid, that's a drug, but which we'll talk about. Pepsin, when activated by exposure to acid. So remember, this breaks down the proteins. So this part breaks down proteins, the pepsinogen going into pepsin. Then we have mucoid cells. These are mucus secreting cells. They provide your protective barrier, and they protect against self-digestion by hydrochloric acid. So, you know, our body has hydrochloric acid. It needs it in the stomach to digest this food and protect it from infections, but yet it needs a balance also. So here's just a picture of your stomach. And to understand, up in this area, this is the top of, in the inner side of your stomach, and it goes down to show you all the different layers. So we have your gastric pits, and then gastric glands, mucosa, blood vessels are in there, a muscle layers and connective tissue, and then your peritoneum, which is on the outside here. And then this also, the regions on the stomach show you here. You have your cardiac portion, the fundus. Remember, the large portion of it is your body of it with the gastric cells, the antrum pylorus. All right, so just kind of study this a little bit to understand, you know, the different parts of the stomach and where things are working. And if you have to go back to the other slides, please go back to the other slides and try to understand the cells versus the acid secretion versus the glands, stuff like that. So what are some acid-related diseases? So it's basically an imbalance of the 3 cells of the gastric gland. So remember the cells of the gastric gland. We have the parietal cells, mucus cells. We have that pepsinogen here that breaks down the proteins. So, but most common is hyperacidity, because things are off balance, right? So they report symptoms of overproduction of the hydrochloric acid by the parietal cells, indigestion, sour stomach, heartburn, and acid stomach. So there's peptic ulcer disease, GERD. So peptic ulcer disease is an ulcer in the stomach. You have GERD, which is your gastroesophageal reflux. That's your esophagus. And then you have H. pylori, which is actually a bacteria. It's very interesting with the H. pylori. It's bacterium found in GI tract. 90% of patients with duodenal ulcers and 70% of those with gastric ulcers. So it's highly related to ulcer disease. Or actually, I should say, you get the H. pylori and it causes an ulcer. Usually you need a combination of antibiotics and other medications, such as Pepto-Bismol and like a Prilosec, which we'll talk about those types of drugs. This is H. pylori is one thing that can live in an acidic environment, one bacteria. So there's 8 regimens approved by the FDA. It's not associated with acute perforating ulcers. Let's just say you have an acute ulcer from having too much ibuprofen or NSAIDs or alcohol. It's not associated with that. It's more or less you have the bacteria in your stomach and you develop this ulcer. So what are some types of acid controlling agents? So there's 3 basic categories. There's the antacids, the H2 antagonists, and proton pump inhibitors. So H2 blockers, which we talked about before. So antacids were first developed by the ancient Greeks, who used crushed coral, which is calcium carbonate, to treat dyspepsia. Dyspepsia, meaning like a little bit of acid reflux, burping, things like that. Your H2 blockers, it wasn't until the 1970s that a new class of H2 blockers was developed. So for a long time, all we really had out there were the calcium carbonate to help try to reduce the acid in the stomach. Then we have the H2 blockers, which would be your Pepcid and Zantac. And then further on, we have proton pump inhibitors, which came later. So regarding antacids, let's go to that. What's their mechanism of action? Well, we want to decrease the amount of acid in the stomach, right? So it's a protective barrier against the hydrochloric acid. It helps buffer the acidic properties of it, and there's prostaglandins. They prevent activation of the proton pump, which results in decrease in hydrochloric acid production. So think about when you have your prostaglandins, this is what I think about too. You have proton pumps, all right? Proton pumps is what secretes the acid into your stomach. And if you are over-secreting acid, those proton pumps are over-secreting the acid into your stomach. So then you start having indigestion or heartburn, sometimes, or it can create an ulcer over time. So what this does, it helps prevent the activation of the proton pumps in your stomach. And so that way you're not going to get as much acid secretion circulating in your stomach. We can go over this in class too. Okay, so antacids do not prevent the overproduction of acid, but they do neutralize the acid once it's in the stomach. Okay, so when you think of Prilosec and Prevacid out there, those are the proton pump inhibitors. So going back to this slide, it'll prevent activation of the proton pumps. It'll decrease the hydrochloric production. So that's what it does. It decreases the acid secretion with like Tums that you're taking over the counter, Maalox. So they're not really preventing the overproduction of it, but they're kind of trying to neutralize it once it's in the stomach, once it's released from that. The proton pump inhibitors, which is your Prilosec and Nexium, will actually block those proton pumps so it won't excrete the acid. Okay, so again, antacids, we're thinking Maalox, Mylanta, Tums are common. So what are some of the drug effects? It's reduction of pain, which will do. It's because it raises the gastric pH, neutralizes the gastric acid, and then therefore would reduce pain. They can be used alone or in combination with other drugs that we're going to be talking about. And these are just some of them, like the carbonate, calcium carbonate, like Tums, some hydroxides that are in like your Maalox or Mylanta. They can cause some constipation. Often used with magnesium to counteract constipation. So it's always good to go to when you're at the pharmacy, start looking at the ingredients. And some of these, like Maalox and Mylanta, will have magnesium in it because magnesium can cause diarrhea, so it helps counteract that. Some examples also they put here with the aluminum and magnesium: Gaviscon, Maalox, Mylanta, and Digel, which I've never seen. Aluminum carbonate is basil gel, and hydroxide salt eternagel, which I've never heard of that either. I'll have to look for that when I go to the pharmacy. So usually with my patients, we don't really use those. Well, I usually tell them to take some Tums. You know, if they're having symptoms of heartburn or anything, and if it's only, you know, once to 3 times a month, I'll say use some Tums to decrease that acid. If it's a little more than that, then I won't recommend these. We'll move up a little bit, up a step to like your Pepcid and those kind of drugs. Magnesium salts come in carbonate, hydroxide, oxide, and trisilicate. Common causes diarrhea, usually used in other agents to counteract. Dangerous when used with renal failure. The failing kidney can't excrete that extra magnesium. So then they'll get a high magnesium and you don't want that. So when you're using the antacids that have the magnesium salts, just be careful. You don't want to recommend that anybody with any kidney issues. Milk of magnesia is a common one, a Gaviscon, Mylanta, and Maalox. So any of those over-the-counters. Again, remember we talked about just because it's over-the-counter doesn't mean it's safe for everybody. Calcium salts. There's many of them out there, but carbonate's the most common. So like your calcium carbonate, that's Tums. It can cause constipation, as we talked about. Overproduction or too much calcium can cause kidney stones. You have to make sure you drink a lot of water if you're taking these. If you're taking them chronically, which you shouldn't be taking too many of them, but it can cause kidney stones. A long duration of acid action can actually cause an increased gastric acid secretion. So it's like a rebound. So it's like you're taking Tums every day for 3 months and then you stop it, and what's going to happen, you're going to rebound and overproduce the acid. It's often advertised as an extra source of calcium, which some people do take every day for their calcium intake. Then we have our sodium bicarb, which has a quick onset, short duration. It can cause metabolic alkalosis, and you have to watch out for heart failure, hypertension, renal insufficiency, which really we don't use sodium bicarb too much unless you're in the inpatient setting and you're being monitored. We have other things like anti-flatulence. So if you go look over the counter, you'll find like Maalox Maximum, which will have different things in it other than your calcium. Have the magnesium. Sometimes they throw in an anti-flatulent, which I have to go look to see what's in Beano. I'm just wondering. I've never recommended Beano to my patients, but it's supposed to help with gas. So, okay. Oh, here's some anti-flatulence. Okay, so Simethicone. It's not prescribed too much anymore. There's activated charcoal, which I've never dealt with, but that is one of the anti-flatulents over the counter. Simethicone. So what it does, it really coats the stomach. It doesn't work that well. Sometimes it's like a psychological feeling like, okay, here's some Simethicone for you. It coats your stomach. Some people feel better with it. Others don't. But that's what it does. It supports it coats the stomach. As it says, there's limited data to support the effectiveness. So side effects are pretty minimal. With these, it's more or less you got to watch to see if they have any other issues, such as renal failure and if they have a history of kidney stones. The most common kidney stones out there are calcium oxalate. So if they have a history of kidney stones and they don't know what kind of kidney stones it is, just kind of assume it's a calcium oxalate stone. And so they kind of you want them to avoid Tums and stuff with calcium carbonate in it. So if you have your aluminum, calcium, remember constipation, anything with added magnesium can cause diarrhea, although used together it's supposed to help, and the calcium carbonate can produce some gas and belching. Sometimes it's combined with the Simethicone. Okay, so antacids, drug interactions, you can have some absorption of other drugs. So the absorption may be decreased of some other drugs or it may be increased. So if you have an increased stomach pH, the increased absorption of the basic drug, and then it decreases the absorption of the acidic drugs. If you have a decreased stomach pH, it increases excretion of the acidic drug and decreases excretion of the basic drug. That was confusing. I'll explain that in class. Basically, overall, this is not on your test or anything, but just know that regardless, if you're taking antacids and you're dealing with your acid base balance in your stomach, and so if you're taking antacids, it's muting that, and so some drugs that's meant to go through a stomach that does not have any problems with it, there may be some decreased absorption or increased absorption depending on what it is. Most drugs are either weak acids or weak bases. So that's why when it's going through your GI tract, if you have an issue with your stomach and you're taking these medications, you may have different effects on how that drug is absorbed. So what are you going to do for nursing? You're going to assess for allergies, any pre-existing conditions that may restrict the use of antacids, such as fluid imbalances, renal disease, heart failure, pregnancy, GI obstruction. Patients with heart failure or hypertension should use low sodium antacids, such as Riopan, Maalox, or Mylanta. Remember, with heart failure patients, many have renal issues, so you got to watch that too. Use with caution with other medications due to many drug interactions. Most meds should be given 1 to 2 hours after giving an antacid, which would make sense now that we've talked about our acid-base balance in our stomach. Antacids can cause premature dissolving of enteric-coated medications, resulting in a stomach ache. Be sure chewable tablets are chewed thoroughly, liquid forms. Make sure you shake well. That should be common sense. And give with water. Caffeine, alcohol, spices, black pepper may aggravate the underlying GI conditions. So this last bullet point is really the most important thing pretty much that you're going to give to patients, is that really it's diet that is causing a lot of these over acidic stomachs, these ulcers. You know, people that are obese, you look at their diet and what they're eating, so many of it. These are all triggers that can increase your acid in your stomach. Caffeine, alcohol, spices, even don't forget about coffee, chocolate should be on that list too. So for nursing implications, you really should be talking to them about prevention. Yes, we're going to do treatment at a point of a problem. But if we're thinking about health promotion and helping prevent things instead of being in such a disease state society that we're in right now, we need to really work on prevention. So these people, or everybody, even your family, needs this kind of information. Monitor for side effects, which would be basically what's going on in your GI tract. Are you having the diarrhea, vomiting, abdominal pain, or nausea? You may want to rethink your medication choice if that's what's going on. Remember, you can have some acid rebound, and you're obviously going to monitor to see if it's working, and if they're not relieved, you're going to notify the healthcare provider. Okay, so I'm going to wrap this one up, and the next slides we're going to be talking about H2 blockers, because I want you guys to be able to just do this in snippets so you can have better retention in your brain. So, because I know this is already 22 minutes, okay? All right.